I'm Dr. Kat. Testicular cancer affects over 20,000 people in America each year. Cancer starts when cells in the body begin to grow out of control. Cancer that starts in the testicles is called testicular cancer.
Early detection of testicular cancer has been shown to increase the effectiveness of treatment and reduce the long-term consequences. Nurses can provide clients with specific education on testicular cancer and perform testicular self-examinations. In this manner, nurses can have an impact on early detection.
So I heard that men are supposed to do self-examinations of their testicles, so I started doing them, and one day I was in the shower and I felt something that felt like a lump. So I made an appointment with my doctor and he did a physical exam.
More than 90% of cancers in the testicle develop in special cells known as germ cells. These are the cells that make sperm. When cancer occurs here, it's called germ cell cancer. The two main types of germ cell tumors in men are seminomas and non-seminomas. Seminomas tend to grow and spread more slowly than non-seminomas. Doctors can tell them apart by how they look under the microscope. Most tumors are a mix of different types, but this doesn't change the general approach to treatment.
To determine whether the lump was testicular cancer, the doctor recommended an ultrasound, which was a test that helped her determine the nature of my testicular lumps. The ultrasound told the doctor whether the lumps were inside or outside of my testicle. The doctor also ordered blood tests to determine the levels of tumor markers in my blood. Now, she said just because I had a high level of tumor markers doesn't necessarily mean that I have cancer, but it did help her in determining my diagnosis.
Treatments for testicular cancer include surgery, radiation therapy, chemotherapy, and surveillance, where the condition is closely followed without giving treatment. High-dose chemotherapy with stem cell transplant is also an option. With chemotherapy, a multiple anti-neoplastic drug regimen with combinations of neomycin, Vespid, and platinol is given. If it's determined that the lump on your testicle may be cancerous, surgery to remove the testicle may be recommended.
Nursing management prior to surgery includes responding to and addressing the client's emotional distress over having a life-threatening diagnosis, being unfamiliar with the surgical experience, and confronting alterations in body image and sexuality. The nurse provides opportunities for the client to ask questions and verbalize his feelings. After an orchiectomy, the nurse applies a scrotal support and gives prophylactic antibiotics to prevent infection, as well as pain medication such as narcotic analgesics. As the client's comfort improves, the nurse should provide opportunities for self-expression and information on support groups after discharge.
I was so happy that I beat cancer, but after my surgery, I just wasn't the same. I was depressed, and I couldn't stop thinking about how my appearance had changed.
After an orchiectomy, some patients have a disturbance in body image. Patients may also experience depression and a lack of self-confidence. Some patients may consider testicular prosthesis to restore the normal appearance of the scrotum. An artificial testis, also referred to as prosthetic testicle or testicular implant, can be implanted to restore the normal appearance of the scrotum and to restore the quality of life.
That's where Prostatesti comes in. Prostatesti is the only FDA-approved silicone prosthetic testicle in the United States, and it changed my life.
Side effects include cosmetic imperfection, agitation, scrotal redness, swelling, bleeding, silicone leakage. Please report any side effects or adverse reactions to your physician.
Thanks, Prostatesti!